Let's talk about the evolution of nonprofits. We live in interesting times. When you think about it, we want to say to ourselves, how did we get here and where are we going? I really like this slide, and I think all of us have thought of ourselves from time to time in the last year or so as the little person who's hanging off the ledge on the screen. We feel like we're just hanging there by the tips of our fingers. The reality is we need to think about what kind of model do we need to wrap our arms around what's happening today and where we need to go in the future. This is a fantastic quote that I really like, and when I check myself to say we already do this or we already have all of these skills, think about this quote by William Pollard. Learning and innovation go hand in hand. The arrogance of success is to think that what you did yesterday will be sufficient for tomorrow. So let's talk about a nonprofit evolution model. Sort of how did we get to this place? And in thinking about this over my career in working with nonprofits, I think this is just spot on. And that is, we all started out doing God's work. Most of us are in organizations that started out in the late 1800s or early 1900s as settlement houses or orphanages, really geared and supported by philanthropists for a single cause or a single purpose. These models truly were God's work, and they were pretty easily funded by a religious organization or by somebody who wanted to support that social cause. In the 1960s, with the advent of the Johnson administration and the Great Society, we moved into what I like to call the agent of government phase. In the Great Society, what we looked at was wanting to do more for our fellow man. And in doing so, government needed really an army of helpers. And so it reached out to a series of philanthropic providers to be able to be those extenders of government service. Within this agent of government period, we saw a proliferation of small nonprofits, medium and large. This has really, though, been a fee-for-service model and a fee-for-service approach to delivering that care. And that's something that we're still living with now, but I think we're at the end of this agent of government phase. Some familiar thoughts and ideas that you may see with this? In part, it may be, oh, I'm waiting for my government contract, or let's wait to see what the city, county, or state says about that particular issue or topic. Most of this is dictated by whoever owns the contract or whoever is providing the reimbursement, be that Medicaid or Medicare. We're on the cusp, though, of a very different phase, and this is a phase that I like to call retail. It's not your typical retail. This is not about turning nonprofits into Walmarts or Sears or Targets or some other business operation. This is about us, though, moving into value and moving into a retail situation where it matters what it is that you're delivering, and it matters to the payer. So we have to begin to think about our evolution, again, from God's work to government's work to retail. So one of the first things I find whether I'm running an organization or whether I'm talking to people, and I say, you know what, the world is changing. Do you know what the first thing that happens is? Usually people will start to fall in love with their past system. So the same system that they would come in every Monday morning and complain about and say it didn't work for them, suddenly when you say it's going to change and we want you to move to a different way of looking at your work, suddenly people fall in love with that. And so this slide is to help us remember in a 2020 hindsight way that our agent of government phase had a lot of problems with it, all right? So as we look at this, and you'll see there's a fair amount of scenarios on here, but let's start talking about some of them. One is that price has no connection to cost. So in an agent of government world, the government decided that they were going to pay us X amount for Y service, but that doesn't necessarily relate to what our cost is. And we've seen that here in New York State. I think a great example of that is if you happen to be a clinic provider, you happen to have a government contract, whether that government contract is in Orange County or Jefferson County, you may have the same rate. And we know that the costs are different in those counties. So over time, we've really become disconnected from what our provider costs are, and that's very significant to us as we head into the retail market. Also, we've had policy changes that have shifted before the incentives or the system has changed. And my premier example on this is really looking at regulation. that the state's policy around value-based payment, around person-centered services, around looking at outcomes have really shifted. If you listen to the state agencies, if you listen to the governor, there's really a shift in that policy, yet the financial infrastructure that we're operating with and the regulatory structure have not changed much. One of my other favorite ones is that when we think about the change to retail, oftentimes we think about that from a business perspective. But from a quality of care perspective, people who need specialized services have really not seen the benefit of evidence-based practices. It's still about 15 to 20 years before things that we know in science are going to help people get better get delivered on a scale. And so that's something that we haven't been able to move the dial with in our agent of government phase. Additionally, and I think this is one that hopefully you will all in some ways be smirking at, but government has really shifted risk over the length of time in our agent of government phase to providers. In the 1960s and the 1970s, we had, for those of you who are young, we used to have this thing called deficit funding. And deficit funding was you would go out and provide a service. At the end of the year, if you had a deficit of $10,000 or $300,000, the government would write you a check for that amount of that deficit. So really the risk of your performance was borne by the government. Over the last 30 years, that's really shifted to now where we have challenges in this agent of government phase where we don't have cost of living adjustments, we don't have increases or changes in the rate or regulatory environment. And so if you aren't able to deliver that service with the rate that you're getting, the risk is really on you as a provider. So again, those are some of the examples of how the agent of government model has not been as effective and has not been a positive force for us as we near this century. So let's talk about what do we mean by retail markets. What does that look like? How does that change what it is that I need to do? So first and foremost, there are organizational changes. So from an organizational perspective, you have to stop thinking of yourself as an island and start thinking about yourself as a network provider. There are a lot of acronyms that get tossed around, whether it's IPAs or ACOs, but I think the main piece for you to think about here is really how do I affiliate? That I need to be thinking about not only my particular field, so if I'm a developmental disabilities provider, if I'm a food pantry, if I'm a behavioral health provider, I have to think beyond that and think into healthcare, think into other social determinants of health, and really build my affiliations out, which is very distinctive and different, again, from our agent of government phase, where we had one contract and were able to deliver on that contract. The next area is that there's financial changes, right? So when we had simple contracts, and maybe simple needs to be in air quotes, but when we had simple contracts, or when we had billing that we were doing to one payer, to Medicaid, things were pretty simplistic. Now, when you think about the variety of payers that you have, the variety of contracts that you have, it's not unusual for some of our nonprofit friends and providers to say they have 50 different funding streams. So that requires a different complexity around your financial operation. It requires a different complexity around reporting, and it requires a different complexity around costs as well. So increasingly diverse payers means that you really have to look at your financial operation in a very distinctive way. The last area is really clinical change. And so when you talk about a different service delivery model, or when you talk about retail, this is not about just business operations or something that you send your chief fiscal officer to. This is something that an entire organization really has to embrace and has to look at. So from a clinical perspective, when we move from a volume-based perspective to a value-based perspective, it's not just about seeing, do you have the right productivity target, but it's saying, did you really make a difference in that person's life? Did you hit that outcome that we're targeting? If the target is that somebody gets into your care on the next business day, and that somebody is seen by a psychiatrist or seen by a particular professional or gets their food delivered to them that's medically appropriate within 24 hours, you have to make sure that you hit that quality marker. And so that really requires a total change in the way that we look at some of our clinical paradigms. And going back to the prior slide, this is where we really hope to be able to move the marker on getting science-based practice out to scale very quickly, because there's going to be a reward for looking at those positive outcomes. Thank you. Now let's move to talking about millennial nonprofits and working what I like to call the distinctiveness wheel. So when I was thinking about how to help nonprofits move from the agent of government phase into retail, I thought it was really important to start to give people a target of what to move to. Too often we hear what it is that we're not supposed to be doing, and it's tough to find direction from that. So what I'd like to share with you today is what I call the millennial nonprofit distinctiveness wheel. And we're going to work our way around this wheel so that you understand what are the essential components for success in a retail environment. The first is your mission, and that is your true north. I think it's important that you think about this mission, though, in a retail environment, and that you look at this and you say, is it something that is going to help me in the future? Or does it represent my God's work phase or my government's work phase? One particular idea that I have that you could think about with this is to take a look at what Simon Sinek talks about at Start with the Why. It's a great idea of getting you out of your comfort zone to come back into why do you do the work that you do. So that's one reference that you can use. Also, though, as you think about your mission statement should be clear. Your mission statement should be able to be read by someone who doesn't know anything about the work that you do and be engaging, be something that they're excited about, and be something that they want to learn more about. But most importantly, it has to be clear and succinct. A good test for this is to develop a mission statement and see if 5 people in your organization are able to repeat it 5 days after you've told it to them. These are some examples of some short, concise mission statements. What you want to avoid is something that's very lengthy, very wordy, full of jargon, and no one in your organization can repeat. Also, in a retail environment, it's very important that people are able to quickly get a sense of what it is that you do to know how that's going to be important for them moving forward. I'm also going to give you a tool and a template that you can use that helps you work through, is this something that is clear and concise, or do I need to continue to work on my mission statement? So let's work our way around the distinctiveness wheel. Let's assume that we've worked on our mission. It's a true north. We've updated that into a retail-based presentation. Where do we have to go to next? Let's focus on expertise. In a retail market, you really want to be able to say, this is what differentiates me from other people. I have particular expertise in fill in the blank. But you have to make sure with your expertise that you have an adequate amount of talent, that you have the scope that's necessary so that you can meet the level and scale that's necessary in your community, and that you make sure that you can deliver it on a consistent basis. It's not good enough to just have expertise one time. You have to be able to repeat that over a period of time, and you have to be able to build your reputation around that delivery of the expertise. Location. Location is very important. You hear about that in real estate. It's important in our world too. And so as you think about moving to retail, you want to take a look at location, and you want to ask yourself the question of, is it something that is accessible? Does it show that I value the people that walk through the door? If you have walls that need to be painted, if you have broken windows, if you don't have good signage in your program, that should be a concern for you. You have to think about stigma. The truth is, people may not walk through the door if there's a big sign that says, come here to get your mental health treatment. So we have to think about that again in terms of what's going to help people access our services. Also, though, you have to start thinking about competition and market share. And perhaps you've had a location for 100 years that you now need to move away from and move to a different area because that's where your expertise is. So start thinking about location differently. System affiliate, said most simply, healthcare is a team sport. You can't be out there on your own. You have to think about how you're going to connect in with the system that you're working with. Next is results. Now this should be obvious, but a question that I'd like to ask you is that, do you have the ability to look at your results today? Many of you may be saying yes. I think the question is, would you be willing to enter into a contract? Would you be willing and able to have those posted on the internet today? So think about your results. Can you track them? Can you show them? And if you can, would you do a business deal based on them? The next area is return on investment. So you have to look at costs, and you have to look at, are you going to be able to deliver that service at a price that someone is going to want to pay? So you do have to be able to look at your fixed and variable costs. You do have to be able to look at, if I'm able to deliver a better outcome, perhaps the payer is willing to pay more for that, but make sure that you have your strong business case for the service that you're providing. And the last area is messaging. And I think a good question for us is, we in our own worlds, and we perhaps in the communities that we live in, may be very prominent citizens where we feel like we have really strong name recognition, but we have to start working on messaging in different ways. And the reality is, oftentimes, people don't know about social services until they have the need for that particular social service. So think about your messaging, keep it simple, look at new ways that people are communicating on social media, and be able to build a more retail presence for your organization. So leading with these millennial leader steps, if you can lose your agent of government thinking, start working this millennial nonprofit wheel. You can do it in small ways with your leadership team. You could build it into your strategic planning process. But if you're able to do that, you can work in your organization to become a flourishing business for good. As we continue our journey towards value-based payment, we can't forget a stop with organizational assessment. As you pilot your agency towards retail, one of the things you have to keep in the forefront of your mind are those problems that we discussed with the agent of government. This is also the time to have a candid and robust review of your strengths, weaknesses, challenges, and opportunities. So as we set the stage for this, we need to think about what are some of the challenges that we've seen. One is that we tend to see nonprofits that have very thick reputational veneers. We tend to think of ourselves in certain ways and maybe miss some of the things that we need to take a look at. And what's interesting when you think about nonprofit organizations that have been challenged in making this transition from agent of government to retail, sometimes we've missed the cues. And when I say we, I mean government, foundations, philanthropists, and even ourselves in our own board and leadership. So we need to think about this very carefully. So when we think about the influences of success and failure, let's talk about some external sources and factors. So we have the environment, we have the market that we live in, we have government, we have access to capital, all of which affect our ability to be successful in this retail environment. And then there are internal factors, such as our own leadership, our people power, and our systems that we have. I wish I could stand here before you today and tell you that this transition from agent of government to retail was going to be swift and it was going to be linear. Here's the day when this is going to happen. In reality, we all have to find ways to be able to keep the plate spinning and keep our agent of government businesses going while we make some fundamental transformations in the way that we do our business. An example of this that you may want to think about is in delivering your services. As you encounter a challenge, perhaps you either have a deficit in the program or you're not seeing the number of clients coming into that service that you have in the past, you may need to stop and think about how you would want to solve that, not with your agent of government hat on, but much more with your retail hat on. And think towards the future of how you can create a solution that can help you in really growing and thriving as a retail organization. Another component of this is to really take that, again, candid and robust review of yourself. I think it's very difficult for agencies to do this within themselves. It's very difficult to have a leadership organization, a board, a corporate compliance person, your quality improvement organization take that candid look at yourself. I really strongly advise getting a fresh set of eyes and an external source to be able to do that. These, though, are the characteristics and the areas that you're going to want to focus on. Why, you may say? Because these are often the source of some of the biggest challenges when you think about referrals, when you think about financial success, and when you think about your ability to grow in different ways. Some of these may seem very familiar to you. Quality improvement, audit, IT, but when you start thinking about organizational culture, when you look at supply chain, some of these may be a little more uncomfortable for you, but these are areas that are really taken from retail organizations, taken from businesses and things that they look at, again, to identify strengths, risks, threats, and opportunities. So these are the kinds of questions that you want to dig in with your own organization. Just before we leave this circle of organizational domains, the other thing that I would encourage you to look at is the Abilene paradox. And that really is a quick story about 4 individuals who got in a car together on a very hot day in Kansas to go out for dinner, suffered through that experience, nobody enjoyed that process, and then at the end of that said, why did we do this? And the reality was that they hadn't had the conversation, they hadn't had a shared agreement on what it was that they wanted to do. So think about that as you look at your own organizations. So finally, you really need to know where you stand so that you're ready to act. In what ways, you might say? Well, you want to be able to say, what is it that we need to strengthen? What is it that we need to repair? And also, what is it that we need to divest ourselves from? And I think that divestment is sometimes the most challenging for us. We want to try to continue to do the things we've done in the past. We want to try to make them better and believe they can be better. But in this retail environment, you have to be equally prepared and ready to not provide some of the services that you have in the past.